So I tell you what, let's, since we have a quorum, let's bring this meeting of the Norfolk Board of Health for November 16th to order. It is 7:08. And let us proceed with our agenda. And on the agenda,
I do have, I'll share my screen and I have
okay.
the variant preamble for you if you want to call. There's the agenda. Can you see that?
All right, let me, 1 second, I got to erase. I just brought up the agenda from an email. Let me get rid of it. Uh-oh, I got rid of you guys. There we go. All right, I got it now. So do we have?
Cheryl's joining us. She thought it was tomorrow night. Uh-oh, is Tom frozen?
I can't see him anymore.
Oh. That's what happens when you
Try to tie in from the Bahamas.
All right, maybe he'll come back. Come on, Tom.
Well, good thing Cheryl's coming.
I think he will come back because he said that he just lost you, and then he's probably gonna click back on.
All right, maybe he'll be able to jump back on.
Yeah.
All right, come on, people.
Where's your cat today?
I don't know. Must be napping. Okay. Okay. Oh, there's Tom again.
Hello.
Hello
Welcome back.
again.
Too many miles, I guess. Sorry, guys. I'm not sure what just happened, but is Cheryl here now?
She's not. She's coming. She said her computer is taking a long time starting up.
Oh, well, I can identify with that. So back to the need for inaugurating a public hearing. Do you happen to have a copy of the preamble?
Yep. Oh, here's Cheryl now. So I'm just letting her in and I'll pull up that preamble. There we go. Can you see that?
There it is.
Yep.
So let me read what you all can read, but I'll read it anyway. This variance hearing for Board of Health Regulations is called to order. This is 16 Mohegan?
Yes.
Okay. It is my duty to inform the applicant that you'll have to provide the Board of Health with data to support your request for a waiver of our requirements, and that if you don't receive the waiver, it'll do you manifest injustice. You've also got to show that what you intend to do is environmentally acceptable. So at this stage, we ask for a presentation from the applicant.
Hi, Greg Bonovitz, Borderland Engineering.
Welcome, Greg.
Good evening. Here tonight representing the homeowners, Mr. and Mrs. Epley from 16 Mohegan Street. So this is a septic system upgrade. It's not considered a new construction. It's an upgrade for the home, an existing home. They're selling their home and they need to upgrade it to Title V standards. It was built in 1973, so they got a lot of years out of their existing septic system, and they need to, upgrade it to the Title V standards. So what we've done is an existing condition survey first. The lot's approximately 30,000 square foot lot, 3/4 of an acre or so. It is on a private well. The surrounding lots are always also on private wells. We're maintaining over 100-foot distances to those private wells. The perk test, we did soil evaluations. The soil was suitable for a septic system. However, the groundwater table was high. We just got a lot of rain, particularly the day before the perk test, and it brought the groundwater table up there. This area in general is a high groundwater area with the models indicating high groundwater table. So what we had to do in place of a perk test is a sieve analysis. The Title V code allows a sieve analysis to be performed in place of a perk test when the soil is too wet. So we've determined that it was in the field with the agent that we took samples of the soil and went through the procedures of the sieve analysis, and we got the report from a independent laboratory from the analysis for both test pits. So that determined our perk test rate. And then the other variance we need to ask for, or local upgrade approval, is the outlet side of the pump chamber is the lowest pipe that's coming out of the house. We have to gravity feed from the home to the septic tank to the pump chamber, and then pump it to the new septic system. So the outlet side of the pump chamber is less than 12 inches to the seasonal high groundwater table. So that's a requirement, and we're going to ask for 2.5 inches as opposed to, in my request initially, I asked for 6 inches, but I did notice that it needed to be reduced to 2.5 inches from the groundwater table. So that's the other variance that we need to ask for.
Okay, thank you,
Mhm.
Greg.
Yeah.
At this point, we normally call upon our engineer, Wade Saucier, to provide our advice or his advice to the board.
Good evening, gentlemen and ladies. Yeah, Greg's pretty right. The area where Mohegan is, it's really bad soils, high groundwater, complicated with a bunch of private wells. The design that you have before you, the soil absorption system is positioned in a really good location. It's 100 feet from all the neighboring wells. Groundwater is very high at the time, couldn't perform the perk test. So 2 sieve analysis samples were taken and came back from the lab. And with the sieve analysis, we get a laboratory loading rate for the design. And it was 0.33, which is the highest you can design for that classification of soil. So it's a huge system. And as we mentioned earlier, groundwater, to keep the system or the tanks underneath the ground itself. The inlets and outlets are lower down towards the groundwater, and that's where you're getting the 2.5-inch variance request. It's good design. I'd recommend approval. The only thing I would probably recommend, and Greg's pretty careful engineer, is to have the soil absorption system staked out for the contractor, because if you look at the plans, it's right between 3 wellheads, and it's just right there. The buffer, the 100-foot buffer is right where the leaching facility is. So the location of the system has to be exact. But other than that, I'd recommend approval.
All right.
Anybody has any questions, I'm here.
Excuse me, Wade, I actually did stake out the septic system already, so I already made sure of that. I saw that it was pretty close to the wells.
Yeah. See, I tell you, he's pretty careful.
Good anticipation, Greg.
Yes.
Is there any question or comment from a member of the board?
Nope.
Well, based upon Wade's recommendation, is there a motion to approve the request as presented?
Are there any comments from anybody?
Oh, sorry. Are there neighbors or abutters who are interested in saying something? Apparently not. In that case, is there a motion?
Yes, I move to accept the recommendation for the septic system upgrade at 16 Mohegan Street.
I second the motion.
There's been a motion seconded. Further discussion?
No.
Apparently no need. Is there, well, all those in favor, please say
Aye.
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 Motion is carried. Thank you, Greg.
Well, thank you, Mr. Chairman. Thank you, board members. Good evening.
Thanks, Greg.
Thanks, Betsy.
All right, next item on the agenda.
I lost my agenda.
Me too.
Give me a chance to see
Just
if I.
send appointments.
Yeah.
Yeah, so there's really, I can do it from, actually, I can do it from memory. So I think it's just COVID discussion, and Alyssa is actually, I just sent her a text. She was gonna jump on and join us for the discussion, if you have any questions for her.
And I apologize to my fellow board members. My brain was saying it was tomorrow night. I was convinced until
Well, it was
Betsy.
supposed to be tomorrow night, and on our minutes, actually, it actually says it's for Monday, November 17th. So wrong day and date. So I
I did change that. I noticed that today on the meeting minutes.
But luckily we have text ability, so.
It helps.
Are there any appointments?
There are no appointments. The next on the agenda is to review and approve the October 14th minutes.
Right. Now we've got the date correction already taken care of, right?
yes.
And let's see. I did have one thought of my own. Um, in the minutes just before the next meeting entry, the discussion was about the 17 Lawrence Street data on the
Mhm.
Buckley and Mann site, the PFAs. They're described as compounds that are used to for coating. I think in this particular case, it links up with the Buckley and Mann property a little bit, perhaps. If we say coating fabric or fabric fibers,
Mhm.
the idea being that it's folks like 3M and their Scotch guarding process that were among the people and organizations and materials that used that material. So can we just add fabric fiber if that seems okay with everybody else after the word coating
That's fine.
to make that clear?
Mhm.
And otherwise, I think that's it on my side. So is there a motion to approve the minutes as amended?
I make a motion to approve the minutes as amended.
I second the motion.
All in favor, please say aye.
Aye.
Aye. All right then. Next on the agenda, come to COVID. So in terms of COVID-19 updates, is Alyssa with us?
Oh,
Yeah.
There she is.
Welcome.
I have my little friend here with me too.
Oh, cute.
what's her name?
This is Avi. We have another 15 and a half year old Jack Russell and a new addition Kitty.
Well, welcome all. So Alyssa, an awful lot has been going on in the last few weeks, as you very well know. And clearly one of the most important things, or one of the things that certainly got the entire town's attention is I won't say elevation, but the labeling of Norfolk as being a hotbed of COVID-19. And many people are very concerned about that designation. So is there anything you can report on that topic that might come as, I don't know, calming the nerves of some of the folks in our town?
Well, what I can say is that, to date, we are seeing community spread throughout Massachusetts. Um, the governor came out November the 6th that individuals need to wear their masks both indoor and outdoor public spaces. So that's really important. I do think that we need to work with public safety to make sure that, at rec fields and playgrounds, that individuals are adhering to that. But in regards to the numbers in Norfolk, there's an asterisk. The state denotes Norfolk with an asterisk saying that there's a facility that is attributing to the rise of the numbers.
Yeah, I think the issue is that when news people are broadcasting results and indicating where the hotspots are in the state, they don't have asterisks necessarily in the maps that they present, and so I'm not sure what we can do to fix that, but certainly it's something which has people's attention and anxiety levels.
Yeah, and so I think we should definitely tell the residents to go on the town webpage, because Betsy and Blythe have been doing a phenomenal job to update the COVID webpage.
Yep.
And that's where I think that Norfolk residents should be getting their information from.
Mhm. Yeah, that's true. And social media sites as well are I think we're attempting to make it clear to people, yeah, between the selectmen's efforts and certainly town administrators' efforts. I think there's certainly an attempt to clarify what those numbers really mean.
Yeah, and I
Um,
provide updates twice a week. So the state provides updates once a week,
Mhm.
and I'm providing updates twice a week. And it's a lot.
I have one more question, then certainly I'll turn over to Eileen and Cheryl. Um, we have among the folks in town who may be impacted by this redesignation of Norfolk based upon these, whether there's an asterisk or not. We are in that, high category. Um, the people, for example, at St. Jude's Church, is there anything which could be impacting, our status in terms of, phase 3, step 2, as opposed to phase 3, now step 1, because we're not enabled to be at step 2? Are you familiar with those designations and what the data maybe means to the town in terms of allowing certain activities to happen or not happen because we are in the red category? Is there any
I
concern
had
that
done
you
some
have?
research.
Mhm.
I had looked online with the governor's declarations and gone back to some of the previous ones, a lot of whereases, but it indicated that religious gatherings were somewhat exempt and that it was something like they could have 40% of their
Yep.
community in the service, and to abide by certain rules and regulations in terms of things like dispensing communion. But apparently they seem to be exempt, and I thought their park and pray was pretty cool. That I think could solve a lot of their problems. But it seemed like they were doing everything correctly in terms of utilizing that exemption from the state.
Right. My wonderment about it was, might there be something happening to the town? That was maybe not a great example because, in fact, of their exemption. But are there other activities, for example, that might be impacted by this simply designation of Norfolk as one of the members of the club of, I guess, 30 or so right now, who have high incidences of positivity? Whereas I understand it, restrictions are actually being meted out based upon what category you're in. And I would kind of hate to see the town being told, no, there's things you can't do, or organizations in town being told, no, there's things you can't do, simply because of this town-wide situation that doesn't really impact most of the people in the town. Anyway.
I think that's what a lot of towns were struggling with. I know Rentham struggled with that because they had a nursing home that had a high incidence of the COVID, even though they kept getting put in the red, and it really wasn't the town itself at that point in time. And I know the governor's trying to look at how do you differentiate that when you've got it pretty much isolated in an area, although it's considered part of the town. I think that's what they're all struggling with. But everybody, colleges are now starting to send people home. Westfield State has all their kids have to be gone by tomorrow. Clark University is sending people home. A lot of the universities are telling kids to go home for Thanksgiving and don't come back. So I think we're just seeing the big wave. I know Worcester is really having a hard time. I have a friend at UMass who kind of reached out and said, how's Boston doing? Because UMass is getting filled with COVID patients again, and they're opening up their those emergency satellite hospitals to take care of the patients. So Worcester's getting hit really, really bad right now. As for Boston, my experience, we're starting to see an increase in the hospital. We really haven't had that wave like we did in end of March, beginning of April, that took over every single ICU. But our medical ICUs, our ICU patients are starting to go up, and our just general patients that are inpatient are starting to go up also.
Hmm. Yeah, one thing I see in a place like Boston, for example, where you have organizations like, for example, Northeastern University, which, as Cheryl very well knows,
Yeah.
is doing a lot of testing.
Tons.
And it's the same people being tested many, many, many times. So what that does is tend to drive down positivity rates almost in a unrealistic way, because it makes it seem as if, hey, things are great in Boston, when in fact, in a lot of the community, things aren't great.
Right.
In fact, quite the opposite. But in that particular case, you've got this this extremely tiny positivity rate for large populations of students, simply because they're being tested so often to allow the university to make informed decisions about what should be policy and what happens next.
But I think Northeastern's doing a great job for the fact that the kids are really aware of if they become positive, whereas my daughter has friends like at BC, and they're doing random testing. So, you know, you may get tested, you may not get tested. So the idea of socially isolating is not as intense as Northeastern. Northeastern knows that you're going to get caught because you're getting tested every 3 days. So they're not out having parties, they're not out socializing, whereas other universities are, and you're seeing that especially in the central part of the state.
Well, Alyssa, if you're still with us, is there anything else you would like to add to this conversation, or the things that you've been dealing with in town that should be brought to our attention?
I'm sorry, my dog is she's making
Family matters.
cute. Um, I really cannot stress it enough to our residents that you need to limit your contact with people outside of your family. You know, you need to just hunker down, because when I'm doing tracing, I'm just astonished at the amount of socializing people are doing. It's almost that COVID doesn't exist. And it's scary. And, you know, we're going into Thanksgiving and I'm terrified. And I'm sorry. And also, again, I think it's really, really important that we have clear lines of communication and expectations with public safety. Are they going to, what are they going to do with the mask mandate? You know, are they going to enforce it? You know, I know where I live, I've seen, well, actually, I was walking by the fields and noticed that nobody was wearing a mask, and I actually called the police. And I saw that they drove over and said, hey, you guys got to put on a mask. So are we going to have that discussion with public safety? Do we have signs up? I mean, this is really, really important.
Right. It certainly is. In fact, it's on our agenda to talk about one example of that, but there are many others. Organized sports is actually one where, you know, for those of us who attend, especially youth athletic events, it's pretty appalling how many people, how very few people, in fact, even when they're kind of clustered fairly close together around a field, are not wearing masks. And, you know, maybe most of them are fine and there's no real danger, but if one of them is not, you know, I can't understand how people can just make that assumption that things are fine, when in fact there's an awful lot of data that tells us no, they're not fine.
That's because
So,
it
yeah,
hasn't.
I totally agree.
That's because it hasn't directly impacted them. So we see that all the time, is that they're in their own little bubble and they, at this point in time, think it's just a waste of everyone's time. And, you know, they don't understand what's happening in the hospitals. And you're seeing that in the center part of the United States. That everybody who thought New York and Massachusetts, that we were all crazy, you know, limiting our, you know, activities and having people wear masks and all of that. Texas, they're all getting slammed, North Dakota, every place, and they don't have the resources now. And we're going to get to the same thing because, again, a lot of people, or if they know somebody who had COVID, they had a mild case. It's not a big deal. You know, they didn't have a loved one that was really sick in an ICU, and they didn't see what was happening in the ICUs, and they didn't see what was happening with the healthcare workers. And that's the sad part about it, is that people just are believing what people on Facebook and Twitter or whatever saying, that it's just it's like a cold and it's not a big deal. And you can use science all you want, and they're not gonna listen until they get really sick. I mean, I follow some people on Twitter and they're commenting, nurses are commenting that there are people saying, why am I so sick? And they say, you have COVID. And they go, I can't have COVID because COVID's not real.
That's
Yeah.
disturbing.
Mhm.
I mean, I think a lot of it has to do also with the politicization of
Yep.
this disease,
Mhm.
and the fact that some of our town officials and people who live in town are anti-mask and
Mhm.
think this is not a big deal. And I've read some Facebook posts that deliberately downplay and
Yep.
are using, you know, statistics to,
Mhm.
you know, look like it's not very important. And I certainly do not think that's helpful. And I don't know how we as the town could address that with some of the officials that are putting that out there for the general public, which I find offensive.
Mhm.
Yeah, I've worked with a lot of young kids too, you know, who've had to withdraw from college at this point because, you know, their neurological functioning has just decreased so much that they can't go back to school after COVID. And, you know, when you hear young kids say, "Oh, I'm not going to get sick," it's off. I mean, it's just, we're on the front lines and it's awful. And people need to take this seriously.
I can tell
Well,
you
I guess the
masks
question for
work.
us is,
Yeah.
but what can we be doing as a board that we haven't done so far to, I don't know.
Maybe, you know, as the board, you know, write something up stating how important masks are and how important it is to do social distancing, and maybe post something right before Thanksgiving saying that it's really important not to be going, you know, my family does a huge Thanksgiving every year and we are not seeing each other. We're doing our individual families because,
Mhm.
you know, even if a member of my family said, oh, we're still going to do this, I would not go. I'm going to have dinner with my husband and my daughter. You know, I think, you know, something strongly worded from the board that gets posted on Facebook and wherever else, and that this is our stand, that, you know, masks are important, social distancing is important. And, you know, you look at with this 227 cases and the prison right now, it just goes through a place like wildfire. And all these people are going to be next week all heading out to their families, and middle of December, it's going to be a complete and utter nightmare at the hospitals.
So I just I posted and I can send this to you, Betsy.
Mhm.
Posted something on Instagram today.
Mhm.
Got it from the CDC, but it was like, you know, Karen went to, you know, 8 days ago,
Mhm.
this many people, and you know, she went and she was tested and she tested negative, and then she saw this person and this person, and then 10 days later there was like 22 people
Yeah.
that were exposed. So like you said, Cheryl, spread wildfire. And I think that showing like an infographic like that,
Mhm.
and this is what I'm seeing out in the community. One case, and it's like a big web.
Yep.
Do we need to take a look again at what we did back in May? I mean, we passed some regulations And the question is, are they sufficient in what we said then? And it's a question of just maybe more vigorous enforcement, or are there some things we maybe skipped over at the point then that maybe we need to rethink it now? I mean, the one thing that comes to mind is we kind of left it as an either or. We said, all right, first of all, you got to be in a public place. Generally, the outdoors kinds of situations, because we're kind of a spread out town, really ultimately meant there weren't that many occasions where you had to be wearing a mask if you were outdoors, even if it was, you know, off your property, simply because there weren't that many other people around. Well, yeah, but then when you have situations like, you know, parents and friends clustered around a ball field, or situations that, yeah, technically, maybe or maybe not, they were in some ways addressed by our regulations, but people just aren't applying those regulations to those situations. Maybe we got to say something a little more concrete, that no, outside is no guarantee. Yes, it's a better situation than inside, but still, if you're in an open environment, but there are a lot of people clustered together. I mean, our bringing our boat south over the last couple of weeks, going through the south, you know, where the weather was nicer and a lot of people were outside. They were outside in large clusters of people. And few, if any, seem to be wearing masks. And I'm thinking, oh my God, you know, major spreading event happening right over there, or it could be.
Yep. I have a friend who lives outside of Charleston, South Carolina. She says the positivity rate down there is between 9 and 11%. And nobody wears masks.
Right.
I think if we go back and say that people need to follow what the state guidelines are, I mean, that's basically, those are the best guidelines that we need to, and remind people. And I like Alyssa's idea of putting up that, you know, visual that, you know, one person may have it, or you may get tested and you're not positive yet. It's just starting to brew and you're not going to actually, I mean, how many times have you dragged your kid because you know the kid has strep throat, and you drag the kid down and the pediatrician goes, nope, the test is negative. And 2 days later, you're back again. Oh, now the test is positive, because it's finally, you have enough, you know, especially with the COVID, a viral load to show that there's something going on.
I mean, what if we, you know, revisit some of the regulations that we had asked the police department? So we had asked them to do like a verbal warning, and then a written warning, and then a fine. You know, do we skip the written warning and go from a verbal warning to a fine? If people are out there doing things inappropriately, do we talk about closing down more things because people aren't paying attention? So you close down the playgrounds and you close down the outdoor sports. I mean, if they're just not doing what they're told, then maybe they don't get to go outside and play. I mean, you know, I guess we can be the mean parent. I don't know what else to say.
I agree. You know, the whole issue with the playground is that if people can't follow the rules and you're putting other people in harm's way, you know, maybe it should be closed.
To give some direction to this, Alyssa, do you have a sense, because you see the cases up close and personal, do you have a sense for where the spreading is taking place in town, at what sort of activities tend to be the ones that are causing the most difficulty in terms of community spread?
A lot of sports.
Really?
Yep. Sports.
Not surprised. Okay.
So, you know, some trick-or-treating events. We're about 2 weeks out from trick-or-treating events, but a lot of sports. In some of my other communities, we've recently had to put a stop to some of the sporting activities within the communities because it just was out of control. I don't see that right now here.
Mhm.
But, you know, I mean, I think at some point we may get further guidance from the state
Mhm.
on that because we're all drowning.
Perhaps it's time to have another conversation with Ann Proto, or maybe even also the like school athletic directors one more
Mhm.
time. I mean, I know in our town, for example, I believe this fall there were youth flag football programs going on. In other towns there were not,
Mhm.
and I would think flag football, soccer are sports where there's a lot of contact, and it could be a problem. So maybe we need to be talking to folks about just what are okay sports and which ones you got to rethink the rules a little bit.
How much further into the season are we getting in terms of just the fact that it's, 2 weeks away from December? Are some of these sports still continuing?
Well, now we're cycling out of those sports, but now we're going to be cycling into what, basketball? I mean, basketball, that
Mhm.
could be an up close and personal sport too. It's not thought of as a contact sport, but well, yeah, depending how enthusiastic the player is, it can be. And what other sports are going on in the winter? So I think the idea of reaching out to intramural
Mhm.
kinds of activities that are planned now for the coming season, um, we should be having a conversation with the
Mhm.
directors of those leagues to just make it clear what special precautions need, even when it comes to managing the crowds of people who are there
Mhm.
at those events. I think we need to do something to intersect this, what may be for a town like us, a very important vector. You know, we don't have an awful lot of, you know, places like bars and other kinds of activities, but we do have sports.
I know I was working with some hockey clusters, and some of the bigger arenas actually hired seasonal workers to go up to parents and say, you guys are too close. You need to back up,
Mhm.
kind of like hall monitors. Um, so I don't know if this would be something that we could, ask, a group of parents to volunteer and just say, at the basketball game, would you guys be willing to have that designation? I think, we definitely need to kind of think outside the box, but I mean, I'm terrified about indoor sports at this point. After seeing what was happening with hockey and now basketball, it's really, really overwhelming.
Now, are the schools going to allow people to watch the games? I know, is it going to be limited to the number of people who can come in? How many people can be in a gymnasium at one point in time?
Maybe we need to ask the superintendents
Mhm.
what the policy is,
Yeah.
because I don't think we have an answer for that one.
So for hockey, it was limited, but again, the parents would,
They'll see each
congregate.
other. Yep. Oh, it's a social event too. It's people you haven't seen, but you spent all last winter with, and it becomes a social event, and people forget. I'll be honest though, I'm more concerned about Thanksgiving because I think people are going to travel. People are going to have large events in an enclosed area that's not ventilated very well.
Mhm.
All right,
I
well,
think we'll see schools closed because of positivity from those events.
One more thing that just came to my mind that we may want to put on the website is to remind people not to carpool.
hmm,
Well, actually, there's a sign. So when I drive into Boston every day, and there's a big sign that says, if you carpool with people who are not your family, wear masks.
So working with a lot of my hockey clusters,
Mm-hmm.
that was a big issue with the carpooling. And even with outside of the hockey clusters, it was, a mom carpooling, 4 kids down to Patriots Place. One of those kids were positive, and then 4 days later, everybody else was positive. Mom was a contact, oh, but I was just driving them for like 15, 20 minutes. Okay, but you have to be in quarantine. So, I just I understand that kids want to see each other, but it's just now's not the time.
so, next steps. Talking to athletic directors, I think, makes a lot of sense, just to see what's being planned for the fall and winter season. And maybe being even more forthcoming with, social media and other avenues of just getting the word out.
Mhm.
Because if there's a lot of this sort of snickering and it's an overblown problem going on in the background, we need to somehow put a counterpoint to that.
Mhm.
That makes it clear that we need to be really serious about this, because the data right now are just terrible, and they're getting worse.
Do we need to ask law enforcement again to kind of
You know what?
help us out?
Let's invite Chuck Stone in for our next meeting,
Mhm.
and just make it reestablish what our agreement is, and ask if maybe the enforcement cycle can be somehow invigorated a little bit,
Mhm.
so that people are, being advised more directly that no, you can't do this. And, once, not good, but
Mhm.
second time, there's going to be consequences. Well, I think we've had a significant conversation on this topic.
Mhm.
We are battling a tide that is going in the wrong direction,
Mhm.
countrywide, globally. So,
So do we have any thoughts on the Christmas car crawl coming up?
maybe Alyssa will chastise us, but I thought there was kind of a generally positive reaction on the part of the board to the proposal, mostly because they seem to be adopting the procedures that seem to work for us or work for them
Mhm.
in November for Thanksgiving. Not Thanksgiving, for Halloween.
Mhm.
We're in November now, October. Are there any concerns about it? We've kind of said, seems like you're covering the bases. I hope they are. I hope we have that right.
Alyssa doesn't look too happy. It's hard to say whether there was any consequences from the Halloween scary car thing. I just, don't know what to say. It's similar to similar to Park and Pray. I mean,
Yeah.
You do your best, but just because you're in a car doesn't mean you're in a bubble.
And that they're going to be doing the same thing at Patriot Place. They're doing the lights in the car. So
Yes, yep, I've seen that.
I think I think if you're in your car with your family, and maybe it's that, you're not carpooling with the neighborhood in the minivan to go through, that you're with your family. And again, the recommendations, if you are in a car carpooling with anybody who's not your family, then everybody should wear a mask. I think people need to use some common sense and like to be able to tell people just to knock this stuff off and behave, but yeah, just maybe they can get some common sense and put masks on. Because I'll tell you right now, I'm looking at our numbers. We only have 20 active in our community, and there'll be a lot of pushback that, again, we started talking about the issue with the facility and what's actually happening and whatnot. And I think to also have the message of, we want to keep it low. We don't want to be one of those other towns that, explodes.
On the invitation list for the next meeting, I think I suggested we invite Ann, and only because on our list of things to talk about tonight, we have the Rockwood Road playground mask complaints. And that's kind of just an example of what I was mentioning earlier that I've observed this fall and parents around ball fields watching organized sports events as opposed to kids playing. There's just a lot of close contact. And, if anybody ever comes to one of those events who is asymptomatic, but still contagious, it could easily pass around to a lot of families very quickly.
Masks work.
Oh.
I've been exposed twice.
Anything else, or was it time to maybe think about scheduling another meeting?
I have a date of December 15th.
And it's a Tuesday. I'll be there.
You forgot town meeting is tomorrow night.
And once upon a time, our resident veterinarian volunteered to be the spokesperson for the Board of Health when it came to the discussion around animal noise.
Yes, I was going to put
You're
that
still up
under
for it?
unanticipated new business. So I did. I had a long conversation with Officer Cohen about this. I mean, if you actually read the proposal, the citizens petition, so no person shall keep any bird, fowl, or other animal which by barks, howls, or other noises disturbs the peace and quietness between the hours of 7 p.m. to 7 a.m. of any resident who lives or works within 750 feet. Such noise must be deemed excessive and continuous for at least 15 minutes. Okay, so if you look at that and then you look at our current rules and regulations, this citizens petition is actually making our regulations weaker, because apparently you can have anything that makes plenty of noise between 7 a.m. and 7 p.m. And if it only makes noise for 14 and a half minutes, that's okay as well. Between 7 p.m. and 7 a.m. I just thought this was, we both thought that this was not a helpful rule and regulation. It again is basically taking away the ability of people to make any complaint about something that's making noise all day. And with people now working from home, you have the noisy dog or the crowing rooster or whatever is making all that noise. Some people work at night and they need to sleep during the day. What else did we determine? I would there are many surrounding towns. So Officer Cohen did quite a bit of research. There's many surrounding towns that actually don't permit a lot of these animals. You need to apply to the Board of Health for a permit to have some of these animals on your property. We are not a right to farm community. We are a residential community. And I think if this goes through, people don't understand that at some point someone else is going to put up a citizen's petition and say, you can't own a rooster, or you can't have a barking dog. So this is really just not a good way to approach this problem. So Officer Cohen will be there also testifying against this citizens petition, as will I.
Well, I think that's very well stated.
Thank you.
And so
Agree.
you certainly, well, is there a feeling that we should take a vote of the board supporting what Eileen just said? And
Well, apparently we're actually in charge of all the other animals that aren't dogs. So dogs go to the Board of Selectmen, but all the other animals come to the Board of Health.
Right.
Yes.
Um,
I'd appreciate your vote of confidence.
So do I need to make a motion to support Eileen at the Board of Selectmen at the town meeting?
I second that motion.
Okay.
All in favor?
Aye.
Aye.
So,
You have our full support, Eileen.
Yep.
Thank you. Thank you for that. I appreciate it.
I'd be there giving you moral support, but I'm not going to make it.
That's okay.
No, sorry. Is there anything else, new or old, we need to talk about tonight?
There was something that came up. Somebody had reminded me that the signs that we managed to get made up for the fishing rules and regulations apparently have not been posted because the posts were too expensive. Was that a correct statement, Betsy?
I have the signs. I don't have any posts and I don't have any money to buy them.
Because they were how much a piece?
Oh, I don't have it in front. Oh,
I heard they were somebody said they were $100.
It was like $500 for like how many signs? 9 or 10? Yeah.
It was
Yep.
$500, not per sign, but for the total number of signs.
Right. Yeah,
But we still didn't have the money to do that.
correct.
Who do we normally ask for money to post public health things? Anybody? Donation jar at town meeting?
I think we need to talk to the selectmen.
yeah.
Whoever
W?
has a discretionary pot of money they
Yeah.
could
Mhm.
dispense from.
So the Board of Selectmen or again, the DPW? Since they'd be likely putting up the signs?
Well, there's that too. All right. I'm going to be back in a couple days. I will have a conversation. Actually, first of all, before I get there, Betsy, could you check with Blythe? Does she have any ideas that come to mind quickly on how to get around the post problem?
Sure.
And where there might be a source of money for purchasing and installing these signs. I mean, they're nice signs. They're not doing any good sitting in a container someplace.
Next to my desk.
We know
All
you're
right,
not
anything
doing any
else?
fishing from there.
Say again, Eileen, I didn't hear you.
We know she's not fishing from her desk.
Mhm.
I'm not.
All right. Next meeting is on the 12th, on the 15th of December. Other business? If not, is there a motion to adjourn?
I propose a motion to adjourn the meeting of November 16th of the Board of Health.
I second the
Is there a
motion.
second? All in favor, please say aye.
Aye.
Aye. Good night, all.